Hey there, my friend. Have you ever woken up, looked in the mirror, and felt like your face had been taken over by a bunch of uninvited guests? You know, those pesky little bumps that seem to pop up out of nowhere and ruin your day? Well, if you've ever experienced that, then you're no stranger to the world of acne. Now, I know what you're thinking. Acne? Isn't that just a teenage thing? Well, think again, my friend. Acne can strike at any age, and it's one of the most common skin conditions out there. In fact, according to some estimates, up to 50 million Americans alone are affected by acne every year. But don't worry, we're not going to let those pesky pimples get the best of us. Today, we're going to take a deep dive into the world of acne, from understanding what it is and what causes it, to exploring the best ways to prevent and treat those unwanted blemishes. Trust me, by the end of this, you'll be armed with all the knowledge and tools you need to keep your skin looking its absolute best. What is acne? Alright, let's start with the basics. What exactly is acne? Well, believe it or not, acne is actually a chronic inflammatory skin condition that occurs when your hair follicles become clogged with oil, dead skin cells, and bacteria. Now, you might be thinking, but wait, I thought acne was just pimples. And you'd be partially right. Pimples, or those pesky red bumps that seem to pop up out of nowhere, are one of the most common symptoms of acne. But acne can also manifest in other ways, like blackheads, those pesky little black dots, whiteheads, their pale cousins, and even painful cystic lesions that form deep within the skin. Symptoms of acne. Speaking of symptoms, let's dive a little deeper into the different types of acne lesions you might encounter. Blackheads. These are those little black dots that form when a hair follicle becomes clogged with oil and dead skin cells. They get their distinctive color from the melanin in the skin and the oxidation of the oil. Whiteheads. These are similar to blackheads, but instead of being open to the air, they remain closed off, trapping the oil and dead skin cells inside. Papules. These are small, solid, and often painful red bumps that form when the hair follicle becomes inflamed. Pustules. These are similar to papules, but they're filled with pus and have a distinctive white or yellow center. Nodules. These are large, painful, and solid lesions that form deep within the skin and can lead to scarring if not treated properly. Cysts. These are the most severe type of acne lesion, characterized by large, pus-filled lumps that form deep within the skin and can be quite painful. Causes of acne. Now that we know what acne looks like, let's dive into what causes it. Believe it or not, there are a few different factors that can contribute to the development of acne. Hormones. The age-old culprit. Hormonal changes, especially during puberty, can cause an increase in oil production, which can lead to clogged pores and acne breakouts. Genetics. If you have a family history of acne, you may be more prone to developing it yourself. Thanks, Mom and Dad. Stress. When you're feeling stressed, your body produces more hormones like cortisol, which can stimulate oil production and lead to breakouts. Medications. Certain medications, like some birth control pills and steroids, can increase the production of oil and contribute to acne. Diet. While the jury is still out on the exact role diet plays in acne, some studies suggest that diets high in processed foods, sugar, and dairy may contribute to breakouts. Prevention tips. Alright, now that we know what causes acne, let's talk about how to prevent those pesky breakouts from happening in the first place. Cleanse, but don't over-cleanse. It's important to keep your skin clean, but be careful not to over-cleanse, as this can strip away your skin's natural oils and make acne worse. Choose non-comedogenic products. Look for products labeled non-comedogenic, which means they won't clog your pores and contribute to breakouts. Manage stress. Easier said than done, right? But finding healthy ways to manage stress, like exercise, meditation, or just taking some deep breaths, can help keep your hormones in check and prevent stress-related breakouts. Watch your diet. While the jury is still out, it may be worth experimenting with cutting back on processed foods, sugar, and dairy to see if it helps clear up your skin. Don't pick or squeeze. As tempting as it may be, picking or squeezing at your pimples can actually make them worse and increase the risk of scarring. Treatment options. Of course, even with the best prevention efforts, sometimes those pesky pimples still manage to rear their ugly heads. But fear not, my friend. There are plenty of treatment options out there to help you get your skin back on track. Over-the-counter treatments. Look for products containing ingredients like benzoyl peroxide, salicylic acid, or sulfur, which can help dry out pimples and unclog pores. Prescription treatments. If over-the-counter treatments aren't cutting it, your dermatologist may prescribe stronger medications like retinoids, antibiotics, or even oral contraceptives to help manage your acne. Professional procedures. For more severe cases of acne, your dermatologist may recommend professional procedures like chemical peels, light therapy, or even laser treatments to help clear up your skin. Avoid overuse. Now, while all of these treatment options can be effective, it's important to use them responsibly and avoid overuse. Over-drying or over-treating your skin can actually make acne worse and lead to other skin problems like irritation, redness, and peeling. Scarring. Unfortunately, one of the less pleasant side effects of acne can be scarring. When those deeper, inflammatory lesions heal, they can sometimes leave behind unsightly scars or discoloration on the skin. But don't worry, there are ways to help minimize and even treat acne scarring. Use sunscreen. Protecting your skin from the sun's harmful UV rays can help prevent further discoloration and hyperpigmentation. Try over-the-counter treatments. Products containing ingredients like retinoids, vitamin C, or alpha-hydroxy acids can help fade acne scars over time. Consider professional treatments. For more severe scarring, your dermatologist may recommend professional treatments like laser resurfacing, microneedling, or chemical peels to help improve the appearance of scars. Conclusion. Well, my friend, we've covered a lot of ground today, from understanding what acne is and what causes it, to exploring the best ways to prevent and treat those pesky breakouts. But here's the most important takeaway. Acne is a common skin condition that affects millions of people, and it's nothing to be ashamed of. With the right knowledge, products, and treatments, you can take control of your skin and keep those pimples at bay. So, the next time you find yourself staring at an unexpected breakout in the mirror, don't panic. Just remember all the tips and tricks we've discussed, and approach your acne with a positive, proactive mindset. Trust me, with a little bit of patience and perseverance, you'll be rocking that clear, glowing complexion in no time. If you enjoy this video, please like and subscribe. Thanks for watching.